Welcome everyone to Shree Sai Health Care. Here we are giving the patient all type of treatment under one roof. Like suppose it's a general physician, we have a pediatric, we have a ENT specialist, we are dealing with the dermatological problems, and we also tied up with the Apollo Diagnostic Center for all type of blood test. So we are treating the patient from A to Z, like chief complaint till the proper diagnosis and the treatment plan. Irrespective of the dental issues, we are also dealing with all general problems with the patient. In case any emergencies are there, we are tied up with certain big hospital like 3K Diagnostic Center, Procare Hospital and Chaya Hospital. Regarding the dental problems, we are dealing all kind of dental issues, let's say decay. We are dealing with the pediatric problems. We are doing all kinds of filling. We are doing the bleaching, that is the tooth whitening. We are giving the fixed prosthesis. We are doing the root canal treatments. We are doing the implant procedures. We are doing the smile corrections. So here you are getting all kinds of dental treatments.
We have the concept of a polyclinic along with the dental wing. So today I am just going to focus you about the root canal treatment. Okay, because this is a very common problem what the day to day we are seeing the patient. So I just let you know what is the root cause and why we have to treat and what are the side effects if you are not treating it. Suppose this is the model of a patient. See, can you see the tooth here? When the decay is more, right? When you can see when is more decay, or else we can see here, right? This is the tooth. So whenever the decay is leading to this red zone, this is the pulp of the tooth, enamel, dentin and the pulp. So when the decay or the caries is reaching towards the pulp, patient will complain of the pain. Fine. So we will take an X-ray, we will diagnose it and we will explain the patient the infection is leading towards the pulp. And to treat this, the procedure is known as the root canal treatment, because as we have to treat the canals of the tooth to get rid of the infection. We do step by step the procedure of the root canal. This is the exact structure of the tooth. This, as you can see, this is the enamel, this is the dentin and this is the pulp, the gum area. Whenever the infection is there, suppose the tooth exactly will look like this, right? This is eaten up from the bacterial invasion. Coming to this part, when we are taking the X-rays of the patient, you can see the periapically there is an infection at the apex of the tooth. Then we will just reach with the burrs and the instrument, we will clean the decayed part. Then it comes to the filing, right? We will just file it. The fine files we are using to remove the infection and clean the canals. That is known as the BMP, the biomechanical preparation of the canal, so that fully we can remove the infection. Then it's come to the last stage. We will take an X-ray there also. We will check there should be no abscess, there should be no infection at the apex, and the tooth should be asymptomatic. The patient should not complain of any kind of pain. Then we will seal it with the GP point, that is the Gatta Pacha point. Then we will close it and we will ask the patient to go for the crown. There are so many kind of crowns. As you can see, this is a kind of ceramic crowns. This is a ceramic crown and this is a metal crown, right? This will give the strength to the tooth so it will not break in the future. And here in the clinic we are dealing with all kind of appliances. We are dealing with the, you can see the braces. This will correct the alignment of the teeth. Now we have all the kind of braces, the metallic and the invisible braces. We have the kind of braces, so that is the ortho treatment what we are dealing with, the smile correction. We are dealing with bleaching, that is the whitening of a teeth. Then we are making the dentures. We are also dealing with the implants. Implants is the fixed prosthesis. So coming to the implant, this is the latest technique by which we can replace the missing teeth. Suppose in a model you can see these are the missing teeth. Suppose some infection is there, or in old patient, right, the teeth fallen down. So in this we have to replace with the tooth. So now instead of giving the dentures to the patient, we can give something fixed. This is known as the implant. Implant concept is like we have to put a screw inside the soft tissue or the gum area, which will hold the crown. Then on top of it we'll just put a cap. Is always like safer side. We'll take the x-rays, we'll select the case, and we can do it nicely, means we can fix it out. Of course it includes the surgical procedure, small surgical procedure will be there, but that is not that unsafe, because that surgery will be done only under local injection, that is a local infiltration. We don't have to give the general anesthesia, that is under local anesthesia. Coming to the pediatric treatment, as we are tied up with so many schools, we are doing the free screening so we can motivate and educate the parents. Educate the parents regarding what is the correct age of exfoliation of the tooth, why we have to save the milk tooth, and what are the different ways we can treat the tooth. Because nowadays pulpectomy or the root canal in kids are safe. We can do it without causing any pain. So we can save the tooth for longer time. So all type of pediatric treatment we are dealing in the clinic.
How are you feeling right now?
When I came, there was a lot of pain in my tooth here, and after the checkup, doctor referred for the root canal, and after the root canal treatment, it was much better. I am feeling much better right now.